Okay, welcome to the video. So today I was going to talk a little bit about some stretches that we often prescribe to some of our patients if they have a lot of tightness in the front part of their chest. So, the reason that we might see this is if somebody's doing a lot of excessive pushing. So maybe at the gym, they're doing a lot more push than they are pull. Also think of in a postural setting, they might be a little bit rounded in their shoulders. So in some cases, we might decide that some stretching might be beneficial to that patient. So a couple of things to consider from the anatomy here. So our pectoral muscles, we have two of them. We have our larger one, it's called our pec major, and it's gonna run from the border of our sternum here and our clavicle, and it's gonna come all the way out, and it actually comes to the front part of our arm underneath our shoulder. So it does a lot more of this kind of action here, where our pec minor, which is deeper, it runs from deep in our ribs, but rather than coming all the way out to our arm, it comes all the way back and attaches to the top of our scapula up here. So obviously we want to find out where most of that tightness is, and then we want to, prescribe the right stretching based on what we find. So I'm going to show you the two stretches. So the first one's going to be for my pec major, my big pec group here, okay? And so this is really easy. We actually use just a doorway. We call it a doorway stretch. And the way we usually have patients start off here is we like to have them think is their elbows like hands on a clock. So they're going to start in a 9 and a 3 o'clock position here. So, and all we're looking for here, we're going to get our arms up, so about 90 and 90 at my shoulders and elbows, and I'm just going to give a little lean forward at my chest here. And a couple things that I want to look for, I want to make sure that there's no pain or pinching in the shoulder, and I should feel a really good stretch coming this way. If for some reason, if we get a patient in this position it's uncomfortable, we might play a little bit with those hands on a clock till they find a comfortable position again where they're not getting any of that pinching and they're still getting a really good stretch. Okay, so again, hands on a clock, 9 and 3. I'm going to start to lunge forward, bringing my sternum forward. I'm going to hold that position, and we're just going to hold this statically. And our typical prescription is 30 to 45 seconds. Okay, so that's for pec major. For pec minor, again, that's our deep pec group. So our arm's really not involved with this. Really, all it does is it controls where the position of our shoulders are moving forward because it pulls at the scapula. So a different prescription for this would be, we're going to be on the foam roll here. A lot of our patients at home, they have a shorter foam roll, and that's okay. We're still going to have the foam roll resting between their shoulder blades, and their head can just rest on a pillow or a stack of towels. But for here, I'm going to be all the way on my back, and I can actually rest with my head flat there. Good. I'm going to be nice and stable here, so I might need to widen my legs. So all I'm going to do here, I'm actually going to keep my hands on top, and all I'm going to think about is letting gravity pull my shoulders down to the floor. And that's really it. And I'm going to slowly let it kind of pull back. I'm not squeezing my shoulder blades together. That's going to kind of counteract. So I just want to let gravity kind of pull it back. So 30 to 45 seconds is not going to be our normal prescription like that. Like our doorway stretch for this, it might take a minute or two. And over time, we should see those shoulders start to drop back. And most of that stretch is actually coming at the pec minor. So there we go. So those are the two stretches, guys, that we often recommend if we find some issues there. Let me know if you have any questions, and we'll see you next time. Thanks.